The changes with menopause are pretty profound to the bladder. Your urethra, the tube you pee out of, actually becomes shorter in length. The average lady kind of has a 4 centimeter urethra when she's in her 20s and 30s. And when you get to women in their 40s and 50s, 60s, 70s, 80s, you end up having a shorter and shorter urethra, which has a lot of changes. It'll make a lot of changes to your functional ability with it. Men have these really long urethras that go all the way through their penis, right? It's easy for those to close down and not leak urine. But when your urethra started out this long and becomes, 2.5 to 3 centimeters or less sometimes, it is really hard for your muscles and for those pillows on the inside of the urethra to close up so urine doesn't leak out. So stress incontinence can happen. I'll talk about that more later. There's also the possibility that because it's a shorter length bacteria, it has less of a course to travel to get into your bladder and cause bladder infections. And there's less of a seal on the inside, so it's easier for it to get inside. Those changes are precipitated primarily by estrogen. Estrogen is the big driver of those changes. You also have changes to the lining of the urethra, that tube. It gets less fluffy. It gets less full of blood. It gets less, it's like cushions on the inside of the tube become more open. And when those tubes become open, it is much easier to leak urine from there. And the muscles start to lose a little bit of their muscle mass. And when they start out so small, even a tiny amount of muscle loss makes a huge difference on how well you can control your bladder. There's also changes to the bladder wall itself, to that muscle. And the muscle is no longer easy to accommodate. It's not as stretchy. It's not like I'm trying to fill up with urine and I just get really full and I don't even notice it. The walls get stiffer with the lack of estrogen. And so less urine is able to fill into the bladder, so you go more often. And the stiffness causes more overactivity. It causes more of the sensation to your nerves that, like, oh, I'm full, I've got to go right now.